Insulin resistance is a condition that has roots tracing back to the early 20th century, but its full implications were not understood until much later. The first clues to its existence came from studies on diabetes mellitus, a disease known since ancient times for its characteristic sweet-smelling urine, indicative of high blood sugar levels. In the early 1900s, researchers began to uncover the role of insulin, a hormone produced by the pancreas, in regulating blood glucose levels. The discovery of insulin in 1921 by Frederick Banting and Charles Best marked a monumental breakthrough in the treatment of diabetes. However, it wasn't long before doctors noticed that not all diabetic patients responded well to insulin therapy. Some patients required much larger doses of insulin than others, and despite this, their blood sugar levels remained stubbornly high. This puzzling phenomenon hinted at a problem not with insulin production, but with how the body used insulin, a condition later termed insulin resistance. Insulin resistance occurs when the body's cells, particularly those in muscles, fat, and the liver, become less responsive to the hormone insulin. Under normal conditions, insulin binds to receptors on the surface of cells, signaling them to absorb glucose from the bloodstream to be used for energy or stored for later use. However, in insulin resistance, these cells fail to respond effectively to insulin signals. As a result, the pancreas produces more insulin to compensate, leading to higher than normal levels of insulin in the blood, a condition known as hyperinsulinemia. Over time, the body's inability to use insulin efficiently leads to elevated blood glucose levels, which, if unchecked, can progress to type 2 diabetes. Insulin resistance is also closely associated with several other metabolic conditions, including obesity, hypertension, and dyslipidemia, a cluster of conditions often referred to as metabolic syndrome. The symptoms of insulin resistance can be subtle and often go unnoticed for years. Some of the most common signs include weight gain and difficulty losing weight. Insulin resistance often leads to weight gain, particularly around the abdomen. The body's inability to use glucose efficiently can cause more fat to be stored rather than burned for energy. Fatigue. Since cells are not getting the glucose they need for energy, people with insulin resistance often feel tired and lethargic, even after meals. Frequent hunger. High insulin levels can cause blood sugar levels to drop too low after eating, leading to a condition known as reactive hypoglycemia, which makes people feel hungry shortly after eating. Brain fog. Insulin resistance can affect the brain, leading to difficulties with concentration, memory, and cognitive function. High blood pressure. Insulin resistance is often accompanied by hypertension, as the condition can affect the balance of sodium and water in the body.